Hi, I'm Olivia Casey. I'm the Senior Director of Programming at the Autoimmune Association. And we have with us today Dr. Julius Birnbaum, who is a neurologist and a rheumatologist. And he has a new book out called Living Well with Autoimmune Disease, a rheumatologist's guide to taking charge of your health. What's so exciting about this book to me and to everybody I know who's read it is that this is really an encouraging, uplifting, and engaging, I guess, more of a directive and an emotive read for people who suffer from autoimmune disease. There's approximately 50 million people in the United States who do. Many of them are women. The journey to diagnosis is long, and in many cases, it takes years and sometimes decades. It can be very difficult. It can be very challenging. It can be very lonely. So, Dr. Birnbaum has some ideas and thoughts about that, and he's written this book specifically for patients to help guide them through that path and on their way to a diagnosis. So, I'd like to introduce Dr. Birnbaum. And first of all, I'd like to have him tell us a little bit about who he is. And Dr. Birnbaum, how did you come to be so interested in rheumatology and in neurology, which is such an interesting pairing?
So during the last year of my neurology residency, I had the opportunity to take care of patients with different rheumatic diseases. So I was able to use the neurological examination, for example, to identify spinal cord injuries that occur in patients with rheumatoid arthritis, or the different types of brain lesions that can occur in patients with lupus. But I recognized to have more of a fuller understanding in rheumatology, I need to go back and do internal medicine and then do a fellowship in rheumatology. So I finished my fellowship training at Johns Hopkins. And right after that, I pioneered the only clinic in the country. It was called the Neurorheumatology Clinic. And it specifically cared for patients with the interface between neurology and rheumatological issues. So I had the privilege of taking care of patients from a variety of locales. It can occur patients from 10 blocks away from Hopkins, or sheiks that were from Saudi Arabia. But it was really gratifying for me to really care for patients with this interface between neurology and rheumatology. And I think that propelled my further research studies when I was at Hopkins, really trying to understand how neurological complications can occur in patients with rheumatic diseases.
So tell us a little bit about the book that you've written and what was the motivation for doing that?
Sure. So the motivation was the recognition that while I could have patients individually during their visits, I wanted to have a broader scope in being able to help patients and their loved ones and family members with complications of rheumatic diseases. So that was the motivation. In terms of writing this book, I think the theme that percolates through all chapters is empowerment. So I call this autoimmune empowerment, understanding how you could better partner with your physician when it comes to diagnosis and treatment. So one of these unique aspects of this book is that it's had a compendium devoted to many different rheumatic diseases. So for example, there's a chapter on lupus, chapter on Sjögren's disease, a chapter on vasculitis, and also individual chapters on myositis, on psoriatic arthritis, chapters again on rheumatoid arthritis with scleroderma. So I think it emphasizes how all these rheumatic diseases are interconnected. And I think that once readers understand this interconnectedness, they'll have a better understanding of how to treat different rheumatic diseases. The second aspect of the book is I wanted to include chapters that might not necessarily be autoimmune in nature, that were relevant to any rheumatic diseases. So, for example, there's a chapter on depression, a chapter on diet, a chapter on fibromyalgia, a chapter on trying to demythologize certain myths that are on the social media that can actually distort and harm your care. So I think that's another relevant aspect of the book. And finally, the third aspect of the book is I really wanted to open up my clinic to all the drama and captivating issues that I encounter on a daily basis. And I think that when readers hear my patients' voices struggle with rheumatic diseases, they'll recognize their own voices. And I think once this occurred, readers can actually feel less isolated when it comes to their care. And this is one of the themes of the book, and I hope it resonates well and will transform the care of patients with rheumatic diseases.
I really appreciated that description. I do have a question. So, with regards to the mental health component, and you do stress this in your book, how do you view that? What is the best strategy for maintaining mental health during this process, during this diagnostic journey?
Sure. So I think that one important process, which is definitely resuscitative, is getting enough sleep. And I can't emphasize that enough because during sleep, if you get to that deep stage, it could be reparative and make you more resilient during the day. So, in terms of sleep hygiene, turn off bright objects, don't use electronics, don't look at bright screens before you go to book. Instead, do something relaxing, reading a book, taking a warm shower. So I think that's important in terms of sleep hygiene. Diet is really important. So I know different patients come to me and asking about specific diets. And I actually applaud them because, again, that's a sense of wanting to understand the diseases. I think any diet, as long as it's healthy, is important. You want to eliminate junk food, increase of fruit and vegetables. So that's important. And finally, getting enough exercise. And it's also exercise tailored not only to your disease, but what fits your passions and desires. So, go on walks if you find solace in nature. That's important. If your knees prevent you from participating in more vigorous activities, find a pool, engage in water aerobics, and the water can be soothing to the joints. So I think that diet and exercise are important components to your care. And finally, I think that recognizing features of depression is also important. And I think that sometimes depression is demythologized because it's thought to be of secondary importance toward organ injury, for example, less important than kidney or heart injury. But I think that once depression is recognized, other features can occur. You would be less likely to withdraw from social contacts, less likely to avoid aspects of your life that bring you pleasure. So I think these are the three things: having better sleep hygiene, optimizing your diet, and recognizing how depression can be really corrosive, but how the treatment can gratifyingly improve your quality of life.
I know one of the things that you stress very much in the book is the patient empowerment component and shared decision making. So I'd like to have you talk a little bit about what do you advise patients to do as they communicate with their healthcare provider, and how can they advocate for themselves?
That's a great question. So I think that there's two approaches that readers need to take. So readers or patients, loved ones need to recognize that when they come to a rheumatologists are very pressed for time. They might see as many as 20 to 25 patients a day. So it sounds seem counterintuitive, but you need to sell yourself. And by that, what I mean is not only just say that you have joint pain, but say how the joint pain is affecting you as an individual. So I want to hear, for example, if you're a baker and you're having trouble making wedding cakes because of your joint pain. If you're a fly fisherman and you're having trouble baiting on your hook, that's important. If you're a grandmother and you're afraid of holding your grandchild for fear of falling on the floor, I think that's important. So sell yourself and kind of create a three-dimensional component of yourself that will make your rheumatologist notice you more as an individual. So that's number one. And so I also think it's important that patients understand that physicians are not demigods and that patients have the full right to question physicians about aspects of the care. So, for example, if your physician proposes medications that you're not scared about, challenge your physicians and see why these medications need to be prescribed. If it comes to diagnosis and you don't know why your physicians are ordering 15 tubes of blood, challenge your physicians and ask specifically why so much blood work needs to be ordered. So these are some of the issues that I describe in my book, Living Well with Autoimmune Diseases. I really want them to empower patients and, again, to give patients courage to question their physicians. And ultimately, this will enable patients to have more of a sense of resiliency as well as courage. So these and other issues are discussed in my book, Living Well with Autoimmune Diseases.
Thank you so much, Dr. Birnbaum. And we at the Autoimmune Association are looking forward to hearing more about this kind of future. Thank you.
Thank you, and I'm glad to have the opportunity to collaborate with the Autoimmune Association.